My annual report as Director of Public Health for NHS Lanarkshire for 2010-11 looks at the health of Lanarkshire's population and at the work being done to improve health. While there are positive trends such as increasing life expectancy, fewer deaths from coronary heart disease and a birth rate above the Scottish average, there remain challenges to improving health in Lanarkshire. I want to highlight a few health trends in Lanarkshire, including life expectancy, the most common causes of death, and cancer. For more information on these and on other subjects including health improvement, oral health and local health services, please visit the full report available on our website. Life expectancy continues to increase in Lanarkshire, standing at 74.4 years for men and 79.2 years for women. This is still on average 1 year less than the rest of Scotland. People in South Lanarkshire live longer than those in North Lanarkshire. Men in the south live 1.1 years longer than those in the north, and women live 1.4 years longer. Population projections for Lanarkshire indicate there will be 28,600 more people aged 75 and over by 2030, an increase of 72%. In 2010, more than half of all deaths in Lanarkshire, 52%, were due to the so-called big killer diseases of cancer, coronary heart disease and stroke. Encouragingly, over the past 10 years, this proportion has decreased by almost 10% from 61% in 2001, mostly as a result of a decrease in deaths from coronary heart disease. Coronary heart disease mortality rates in people under the age of 75 are higher in areas of socio-economic deprivation. There is emerging evidence from the Keep Well pilot which targets people aged 45 to 64 in areas of socio-economic deprivation to show that it has successfully engaged with people in deprived areas and helped to reduce the prevalence of risk factors associated with coronary heart disease, such as cholesterol, high blood pressure and excessive weight gain. In 2012, Keep Well will be expanded to cover all areas of significant socio-economic deprivation in Lanarkshire, but it is likely to be some time before the reduced prevalence of coronary heart disease risk factors translates into fewer deaths. Cancer remains a national and a local priority. Currently, on average, 3,174 new cases of cancers occur in Lanarkshire every year. The most common cancers amongst adults in Lanarkshire are lung cancer, followed by breast cancer and colorectal cancer. New cases of cancers are projected to increase in Lanarkshire due to increasing life expectancy and improvement in cancer treatment. By far and away the largest proportion of the increase will occur in the elderly, as an increased proportion of the population survive common causes of premature mortality. All cancer-related services, including screening, treatment and palliative care, should be prepared for an increasing need. In addition, strategies to prevent cancer must continue to be prioritised, including maintaining the smoking ban, interventions on tobacco control and smoking cessation. This should be complemented by strategies to create an environment where people can choose a healthier diet, stay physically active and drink alcohol sensibly. In my report, I have highlighted some key achievements in public health in areas noted in last year's report. For example, NHS Lanarkshire has delivered over 14,000 alcohol brief interventions in the past 3 years to people drinking at levels harmful to their health. People with alcohol and or drug problems can get support on the road to recovery and should have to wait no more than 3 weeks for treatment. The smoking cessation HEAT target for 2008-11 was exceeded, and as part of the smoking prevention programme, Smoke in Your Eyes was launched. This is an online teaching resource exploring tobacco issues aimed at 3 to 18-year-olds and developed jointly with North and South Lanarkshire councils. I hope you will be encouraged to have a look at the report for more trends, information and statistics about the health of people in Lanarkshire and that you will find it of interest. As always, I welcome any comments or requests for further information.